Okay, I think we are ready to begin. Firstly, thank you everyone for joining us here today. This webinar will be focusing on back to school with asthma and preparing for the September Asthma Peak. Firstly, if you are able to hear me, I'd appreciate if you could just type yes into the chat box. The chat box should be showing up on your left-hand side of the screen. Just to make sure, okay, I'm seeing some people are coming in and can hear me. Thank you. If you are having any issues with the audio, please let me know in the chat box at any time. Just going to wait a quick minute so everyone is able to hear me there. Wonderful. Perfect. So thank you again. It looks like the audio is good and we're ready to start. My name is Jenna and I will be the moderator today. I have been with the Asthma Society of Canada for the past 2 years. And again, we really appreciate everyone joining us to learn about this very important topic. Quick logistics. Everyone, all the attendees are muted for the moment. At any point throughout the presentation, please feel free to write comments or questions into the chat box and we will get to them at appropriate intervals. We are also recording this webinar and we will eventually upload it to ASC's YouTube channel. So if you do miss anything or you'd like to pass it on to someone else, it will be there. You can always email me at jenna@asthma.ca to get that direct link at that point. And so very quickly, I just wanted to highlight the Asthma Society of Canada. We are a national registered charitable organization that provides evidence-based asthma information, education, management tools, and support programs for all Canadians living with asthma and respiratory allergies. We do our work, as you can see there, predominantly through education and resource delivery, including webinars like this one, and also through our website, asthma.ca. We also have a helpline that offers information and support, which you can call at any time, and that service is bilingual. Another part of the work that we do is on advocacy in Canada, mostly focusing on government policy change. We've been successful in the passage of Ryan's Law in Ontario, which is relevant to today's webinar. Ryan's Law specifically refers to access to medications in schools, and we continue to work on important issues like that one, both provincially and federally. And the National Asthma Patient Alliance is the patient arm and voice of the Asthma Society of Canada, and they are helping to put on this webinar today. As members, NAPA incorporates the individual into the work that ASC does to both increase awareness and education of asthma and respiratory allergies within Canada, and to help spread the work that the Asthma Society of Canada does. Great. And so now I'm happy to introduce our two presenters for today, Stacey McNeely and Eileen Manaz. Both are registered respiratory therapists with great and passionate careers around asthma education and patient support, and we are very happy to have them join us here, so thank you both. On that note, I will pass it over to Stacey to begin. For everyone, again, if you have any questions at any time, please write them in the chat box and we'll be sure to answer them. So Stacey, are you ready?
I am ready. Thank you, Jenna.
Okay, perfect. On to you then.
So what is the September peak? Are you and your child prepared for the September peak? The back-to-school period brings an increase in asthma attacks and a dramatic increase in hospitalizations for children with asthma. Many parents of asthmatics dread the start of school, knowing their child may struggle with their asthma. The September peak starts shortly after the return to school and reaches a peak in September, often found to be the third week. In Canada, 20 to 25% of children's hospital admissions happen in the month of September. A few stats: 3 million Canadians have asthma. 10 to 15% of children have asthma, or 1 in 5 Canadian children. So in a class of about 30 kids, 3 will likely have asthma. What causes this September peak? It's often caused by the rhinovirus or other viral respiratory infections. The peak is mostly attributed to the increased exposure kids have to viral infections that come with being back to school in close quarters. Other causes we see are a rise in seasonal allergies, which we will talk about shortly, and reduced compliance with medications. What I mean with reduced compliance to medications is often kids do not take their asthma medications on a regular basis over the summer. They may be out of their routines, on vacation, staying with family, friends, or they may not be on the appropriate level of medication going into September. What happens during an asthma attack? Asthma is the most common chronic disease of childhood and affects people of all ages. I'm going to go over a few basic things with asthma. Simply, asthma is a disease of the airways. The airways become inflamed or swollen and produce excess mucus. Asthma is usually caused by exposure to asthma triggers, such as allergies, exercise, colds, viral infections, and we're going to touch on that briefly as well shortly. There are two components to an asthma attack, and the picture here depicts that as well. First of all, the muscles surrounding the airways tighten or constrict, narrowing the airways, making it difficult to breathe. These symptoms are often treated with rescue medications such as Ventolin, salbutamol. The second component to asthma is inflammation of the airways, also causing the airways to become narrow. Inflammation is often treated with daily anti-inflammatory medication called inhaled corticosteroids. The common symptoms of asthma, and they vary from child to child: shortness of breath or difficulty breathing, wheezing, coughing, chest tightness, and mucus production. Tips on how to prepare for the September peak. First and foremost, be that involved parent. Secondly, use an asthma action plan. Developing or updating a plan with your family doctor or asthma educator. And we'll talk more about this as well. Keeping an asthma diary. Asthma diaries can be used either in a paper format or apps. Many smartphones now have apps on asthma diaries. Asthma diaries are really good for looking for trends. You can check peak flows with a peak flow meter. Often that is checked morning and night prior to taking medications. Tracking medication, and that's also a good reminder to take medications. Tracking symptoms. Are symptoms increasing? Is something going on? Is there coughing at night, stuffy runny nose, trouble exercising or playing? Just keeping track of things with a diary. Learning your child's warning signs. And every child is different. Some kids start with a head cold, runny nose, or a cough, or their peak flows may start decreasing. And last of all, talk to your child's doctor. If your child gets frequent colds, mention this to your child's doctor. Update prescriptions and action plans as necessary. The Asthma Action Plan. Research has shown having a written agreement is very helpful when managing asthma at home. All students with asthma should have an action plan. The purpose of an action plan is twofold. First of all, it helps manage your child's symptoms, and secondly, it helps ensure adequate control. If you look on the right of the screen, you'll see an example of the action plan we use at Fraser Health at the clinic I work with. Here we use the 4-zone, color-coded like a stoplight. So green is well, cold, yellow, getting sick is orange, and red is emergency. So if you look on the well zone, you can see the child is feeling well, no cough or wheeze, no symptoms, using their reliever medication as necessary before exercise. Medications are on the right-hand side. Then they move into the yellow zone. They might be getting cold-like symptoms. Something is starting to go on. So with their doctor, they may have medications that they may increase during this period. They start to get sicker. Their Ventolin's not working perhaps, more and more symptoms. Perhaps they're not sleeping. So therefore, they may have another plan as far as what to do with medications and possibly call their doctor. And then when to see emergency care for a severe attack. It is often a good idea to share a copy of the action plan with anybody who is involved with the care of the child. Teachers, caregivers, daycare, any family members, anybody taking care of the child. Emergency response to an asthma exacerbation in school. Lack of recognition of the early signs of asthma deterioration delays the preventative measures needed to avoid an acute and serious attack. Education and communication are the most important tools to identify the early warning signs of the symptoms of poor asthma control. Many school boards and schools already have emergency action plans to respond in an asthma emergency. Having a plan will help ensure that your school is prepared to effectively help a student during an asthma attack. Symptoms of an asthma exacerbation or asthma attack. You often see difficulty breathing. Breathing is difficult and fast. Speaking is difficult. The child may have a hard time speaking in full sentences. Lips or nail beds are turning bluish gray. Skin on the neck or chest is sucked in with each breath. And if you have any doubt, call 911. Immediately use the blue inhaler, Ventolin, etc., and continue to use it every 5 to 15 minutes until help arrives. Stay with the student, have the student sit up, reassure them, and notify the parents and emergency contacts as soon as possible. Triggers in the classroom that may contribute to the September peak. When inflammation is not properly addressed, airways react to common triggers of asthma. Indoor triggers, such as chalk dust. We don't see that as much with our smart boards nowadays. Dust mites, cockroaches, mold, and animal dander. Some arts and crafts products that the schools use. Older kids who are in woodworking shops. I had a patient recently who was in a hairdressing class in her high school, and she was concerned about the bleach and other chemicals they use. Mechanics cooking. There's outdoor allergens. Ragweed season in eastern Canada comes up in the fall. Grass and weed pollen season in western Canada. Exhaust fumes when close to busy roads. And smog in bigger centers. Environmental factors such as cold air, secondhand smoke, tobacco smoke, perfumes. Colds and flus. 85% of exacerbations are triggered by colds in young children. Hand washing is the most best defense against a cold. We'll talk about that some more. School activities. And what I mean by this is exercise, playing games at school. If asthma is well controlled, there should be no physical limitations. Strategies for avoidance of triggers. Basically, how do you stay healthy? How do you avoid getting sick? Number one is education. Education on all levels. Educate your child's teacher, and other staff. Identify triggers that make your child's asthma worse and teach him or her how best to avoid them. Depending on their age, kids can be their own best advocate and manage their asthma. Education empowers kids to have their confidence to take charge. Talking with the school and working together to develop strategies to avoid possible triggers. And Eileen will talk more about schools. Frequent and correct hand washing. We can't emphasize enough. Washing with soap and water is best, but a hand sanitizer in their bag works in a pinch. Obtain enough rest and eat a balanced diet. Encouraging both staff and students to stay home when ill. Keep your child home when they are sick. And if you have concerns about others going to school sick, talk to the school.
Great. Thank you, Stacey. So if there's any questions at this point, please feel free to write them in the chat box. Right now, I do have one from Heather. She asks, at what age can you use a peak flow monitor?
What the recommendations are is age 6. That's the same time that we start using spirometry as well, the breathing test to diagnose asthma. But some kids we can start as early as 5, depending on how well they can follow instructions. I hope that answers your question.
Great, thank you. Are there any other questions at this point? All right, since I'm not seeing any, we will continue for now, and we can move it over to Eileen. Again, please, if you do have questions, put them into the chat box. Thank you.
Okay, thank you so much, Stacey, for a great presentation. And thank you, Jenna, for inviting me to be a part of this webinar today. I was asked to provide a brief discussion on asthma management in school. Schools definitely play an important role in the management of asthma, especially since our children will spend majority of their day at school. As well, as Stacey mentioned earlier, 1 in 10 children will have been diagnosed with asthma upon entering the school year. Ineffective and poor management of asthma will impact the child's health, which is strongly linked to social, psychological, and intellectual development. Schools also play an important role not only in improving the students' academic performance, but also improving their health. There have been studies in the U.S. that have been shown uncontrolled asthma can lead to decreased academic performance. and with effective management, potential challenges and obstacles to effective learning and academic success can be eliminated. As we know, asthma cannot be cured. However, it can be controlled with proper medical diagnosis, management, and the student's adherence to the action plan, which allows children to feel confident and fully participate in school. So why should schools be concerned about asthma? Schools need to be concerned about asthma for many reasons. First, asthma is most common during childhood and affects at least 13% of Canadian children. Asthma continues to be a major cause of missed days of school in Canada. Leading causes of absentees are due to a variety of reasons, such as symptoms, doctor visits, hospitalizations, the need to avoid triggers at school, and sleep deprivation due to nighttime asthma attacks. As well, in Canada, approximately 20 children die each year from asthma, and it's estimated 80% of deaths could be prevented with proper asthma education and management. Through the use of well-coordinated asthma management programs, schools can play an effective role in helping students keep their asthma under control. Asthma management must be a priority for schools by promoting asthma control. Schools can promote asthma control by adopting asthma-friendly policies and procedures. Moving towards an asthma-friendly environment by creating policies and procedures that allow students to successfully manage their asthma. Asthma-friendly schools are those that make an effort to create supportive environments for students with asthma. Coordinating services among healthcare professionals, school personnel, and families to support students with asthma. And finally, providing asthma education for all students and staff to raise awareness and understanding of this condition. Teachers' role in managing asthma is very important, as they are the ones spending the most time with our children. Primary role includes identifying the child with early warning signs, encouraging students to communicate if their asthma is bothering them. Also, discussing asthma with their class, focusing how to identify asthma if worsening and steps to help their peers. This will help reduce the stigma of asthma and increase confidence in their student to manage their asthma. Also, the role includes communicating with school administrators and parents of any changes in the student's asthma control and interference in learning. Most importantly, they should know to access their student's asthma action plan and medication. Finally, daily physical activity is essential to children's growth and development, and teachers should encourage students to participate fully in physical activities unless experiencing asthma symptoms or have a cold that's making their asthma worse. As Stacy had discussed earlier, the parents' role in managing child's asthma. To recap the main ideas, parents need to ensure their children understand their condition, how to take their medication, and ensure their child is confident in managing their asthma in a school setting. Complete and update their child's asthma action plan, ensure medications, inhalers, and or spacers are accessible, and work with school personnel to reduce or avoid triggers of asthma. So policies tend to vary greatly province by province, school board by school board, and even school by school. Currently in Canada, there is no standard practice or policy on medication accessibility and management of asthma. There are some school boards across Canada that have no medication policies at all. Currently, only a handful of provinces allow parents to tell the school where their child's emergency asthma medication will be. Some school boards require that all medication be locked up in the central office, which can sometimes be 4 minutes away from your child's classroom. As Jenna had mentioned at the beginning of the presentation, in Ontario, Ryan's Law was passed in 2015 following the death of a 12-year-old boy who had an asthma attack during recess and did not have his inhaler with him due to school policy. To prevent this unfortunate situation, visit your child's school and ensure policies are in place to help create trigger-free environment for learning, exercise, and play. The National Asthma Patient Alliance has came up with recommendations to help schools to become more asthma-friendly. Schools and school districts need to determine which strategies have the highest priority on the basis of the needs of the schools and available resources. Some of these recommendations include establishing a team to develop, implement, and monitor asthma management programs, identify students who have been diagnosed with asthma and be aware of individual action plans, provide care, support, services, and resources for students who have asthma, ensure quick and easy access to prescribed medications, ensure medication access during all school and school-sponsored activities on the school grounds and off the school grounds. Each school and district is unique and may not be able to implement all the recommendations. However, schools are encouraged to review the recommendations and implement those that are practical. Finally, a strong family, physician, school partnership is essential for students with asthma for positive educational outcomes for students with asthma. Empowering students through resources and skills in a supportive environment helps students develop lifelong skills controlling their condition and improving their quality of life, which also allows for students to take an active role in their own health. Thank you.
Great. Thank you, Eileen. It was very informative. So if there are any questions, please feel free to write into the chat box. I do have a few here, both for Eileen and Stacey, so either one of you. The first one is from Heather. Is there any particular resource that is suitable to provide with my son's school to lay out what specifically would create an asthma-friendly environment? Do either one of you like to answer that, or?
There is the NAPA asthma management in schools best practices, and I think that's on the side right now as well, and that's the one that I think is the one that's used across Canada right now.
Perfect. Thank you, Stacey. Yes, I would recommend, I did just type it into the chat box there if you can download it directly. The NAPA Asthma Management in Schools was created by NAPA, which consists of a in-depth look at different policies in school boards and provincial policies. They incorporated all sorts of recommendations for parents, teachers, administrators, and children as well on best practices. And so this is just a guideline document, but I think it has a lot of great resources and a lot of great ideas in there. And so I would certainly recommend using that with your school. If you do want us to send that directly, please just email us, and we can mail that out or electronically send it out directly to you or to your school. Great. Another question is from Holly. My son has food allergies as well as asthma. Is he at a higher risk of having an asthma attack if he has a food allergy reaction? Is he more likely to react with anaphylaxis?
I think that varies, and that's a great question to talk to your doctor about, depending on how severe his food allergies are, how he reacts, what his reactions are. I mean, some kids with their food allergies, it's just a mild reaction, hives, for example. And others, it's anaphylaxis. And then asthma also varies, right, as far as what triggers. Sometimes food doesn't bother them too much. Sometimes it's more than others. So that is a great question, and I would talk to your doctor and possibly your allergist to find out at what level he is at.
Great, thank you. A question from Jamie. My daughter is 3 years old, and we stopped her orange flow vent in May. Since then, she seems to cough every morning when she wakes up and when she goes to bed every day, although she doesn't cough during the day. Should I start her orange puffer again? Not sure if you're comfortable with those questions.
No, that's a great question. And my response to that is to look at, she's coughing just at night and in the morning, so is there something going on at night? Are there triggers at night? I don't know if they're allergies. Often I talk to parents, and if there's, say, for example, dust allergies, we talk about the bedroom. Is there carpet? Possibly taking the carpet out. Are pets allowed in the bedroom? As far as heating, I mean, keep your bedroom as clean as you want, but unless you close the heat vent, or if it's forced air heat, you're just recirculating it. So a lot of parents will close the heat vent in the bedroom and just buy a small space heater, for example. Other things are stuffed toys. They're dust mites, full of dust mites as well, and heat kills dust mite. So we always talk about putting stuffed toys and anything like that in the dryer once a week for 20 minutes because heat will kill them. So if allergies are a trigger, if that's something to look at, it's hard to say. So I would look at nighttime triggers and talk to your doctor about the flow vent. Until you figure out the triggers, your doctor may suggest going back on the flow vent, because coughing can be the only symptom of asthma in some kids. I hope that answers your question, quite vague, but I would definitely pursue that.
Great, thank you. Another question was, I was told that the chances of my son outgrowing his asthma was far less considering he also has allergies. Just curious if you know that is true?
That's a hard one because every child is different. You know, I've seen kids with very bad allergies and asthma, and they do outgrow it, or it becomes much less severe. And I have other kids with mild allergies, and it keeps on throughout their childhood. So I think that varies from child to child, and I don't know if you can truly say or predict what's going to happen.
Thank you. So are there any last questions at this point? I'm just writing in the chat box a few of the links that you can see on there for more information. These are 3 of the resources that we have. And so I'm just putting them into the chat box so you can actually do a direct link right towards them, and then you can download them whenever you have the time. So I'm just taking a look. I'm not sure if there's any more questions. I'll give it one more moment.
Hi, Jenna. It's Eileen.
Yes. Go ahead.
There's a question regarding, it's from Holly from Ontario. My son was taken off his asthma inhalers, orange and blue, for the summer. Would it be a good idea to start again with ragweed season coming? In this situation, I would definitely follow up with the family physician to see what his recommendations are. If he was on the inhalers before and he has been diagnosed with asthma, it might be something to consider, especially if he's starting school in September. I hope that helps.
Great, thank you, Aline. And Holly, did that answer your question? Yes, thank you. Perfect. Wonderful. So it appears that there's no more questions. Oh, I'm sorry, we just got one from Kelly. She says, sorry if this was already covered, but is there any advice if a nebulizer is better than an inhaler?
Hi, Kelly. Great questions. There have been studies where an inhaler with a spacer is just as effective than a nebulizer. So as long as you have the right technique with the inhaler, it should work just as well. I know some patients that come into the ER, they like the feeling of the cool mist. It makes them feel better. But if you're taking your inhaler regularly as prescribed with good technique, it should work. And I hope that answers your question.
Looks like it does, which is great. Thank you. So I'll give it one more moment just in case anybody is furiously typing and hasn't been able to get it in yet. Again, as I had mentioned, this webinar is being recorded, so you'll be able to come back if there are any further questions. I see one there, but if there are any further you can always email us directly at info@asthma.ca, and we'll be able to answer any queries you have. We have a question from Holly. She says that she had read that is sneezing a sign of asthma?
Hi, Holly. Good question. It's not a sign of asthma, but it can definitely be a sign of allergies and a cold coming on that can make the asthma worse. So if this is a pattern that you've noticed in your child, I would definitely treat it, that an asthma exacerbation may be coming on. But as per guidelines, it's not a sign that we use.
Great. So she had just then came up with saying that her son has been sneezing on and off the last few weeks. So would you recommend at that point then just to go and see a physician, or Aline, or what would your next step?
Definitely. If you're unsure, follow up with a physician, and I'm definitely going to look into that one as well. And maybe Jenna can follow up with you as well with that one.
Yep, of course. Perfect. All right. Well, at this point, I think that we are nearing the end. So thank you all for joining us here, and thank you to Eileen and Stacy for the information. Again, please feel free to click through on our website to get all of those resources, the Asthma Action Plan, as well as our Sarah's Ready, which is our September Peak resource, which has several tips that we talked about in this webinar. You can get all of that at asthma.ca or by emailing us at info@asthma.ca. So thank you for attending, and everybody have a great fall and a healthy and safe back to school.